Hello and welcome back to HealthWatch, presented by Novant Health. I'm your host, June Baker. As always, our show features local physicians and healthcare professionals discussing health topics which we believe you will find to be informative and helpful. Today we are at Novant Health Brunswick Medical Center to learn more about the hospital's general surgeons and the variety of procedures offered. So stay tuned as we meet those surgeons today on HealthWatch. Dr. Beninati, Dr. Scallion, I'm so happy to be here in the OR with you guys today. This is exciting.
Awesome.
Very exciting. And we're going to talk about this new system behind us here. But before we do that, let's tell our viewers a little bit about who you are and what you do. So we'll start with you, Dr. Scallion.
I'm a general surgeon. I trained at New Hanover Regional Medical Center, and I went to medical school at Medical College of Georgia. And I've been here 10 years now.
Long time.
Like it.
How about you, Dr. Beninati? I know you're one of the newer partners.
Right, so I did residency at UMD&J in New Jersey, now Rowan, and then fellowship over in Maryland, Annapolis, under Dr. Park. It was minimally invasive and advanced laparoscopy. Joined the practice about a year and a half ago, and I'm enjoying it so far.
Great. Great, that's good information. So I understand that this is a new Da Vinci robot here at Novant Health Brunswick Medical Center. Is that correct?
Right, we had an older model for a few years, and this is the newer model, and we obtained it about 3 or 4 months ago.
Right. So, Dr. Scallion, tell me about the new system and what it allows you and Dr. Beninati to do in our community.
Well, the robot basically increases our ability to do difficult laparoscopic procedures. It gives us a lot more dexterity. The instruments can move a whole bunch of different directions, whereas before it was basically one direction. And it should allow us to do operations potentially that we couldn't even do laparoscopically now with little incisions.
Great. Well, Dr. Beninati, what specific type of surgeries would you perform with the Da Vinci?
So it's capable of doing really the gamut of the general abdominal surgeries that we do. I do gallbladders, hernias, hiatal hernias for reflux, different inguinal hernias, colon surgeries, just any really advanced kind of procedure in the abdomen, again with the small incisions.
Mm-hmm. Great. Well, I'm excited. I want to see it work. So can we do that?
Absolutely.
Okay, Dr. Beninati, let's get started. So, Dr. Scallion, can you help us understand what's going on here?
Sure. Dr. Beninati is sitting over at the console right now, and he's operating the robot. So he's able to maneuver these robotic arms and do very fine movements. Right now he's actually picking up a suture and moving it between 2 instruments. So normally this would actually be inside of the body, and he could be suturing on the inside of the abdominal cavity.
Wow, that's pretty cool. It's like nobody's working it. It's all so...
But he's at complete control, and there's all kinds of safety mechanisms, and the advantages are incredible as far as the dexterity. And you can see the dexterity with the robot arms and how they're able to move and maneuver the suture.
It's like little fingers. It's just like the fingers are actually doing it.
That's right. It's almost like his little fingers are inside the abdomen. And the robot also eliminates tremors that are hard to notice, but it makes the motion even finer and more accurate, more precise. You could actually suture very small blood vessels or small tubular objects that sometimes we have to sew together. Occasionally we can actually do an anastomosis of the bowel together if that was necessary. But you can see it's pretty amazing what he's able to do. You know, you couldn't do this with regular laparoscopic instruments. Or it's much harder. Let's put it that way. This makes it a lot easier. Expands our ability to do different types of procedures.
Well, does it cut down on the surgical time or anesthesia time?
I would say if you're going to compare it to a difficult laparoscopic procedure, then definitely it would cut down on the time. I think that you'd have to answer that on a case-by-case basis, though.
I see.
The main advantage is going to be taking an operation that you had to do with a big incision and allowing us to do it with small incisions.
Yeah, let's talk about that incision-wise. How many holes would you have?
So it completely depends on the operation, but I would say anywhere from 3 to 5 small incisions would be typical.
And the instruments then would go down through those small incisions and do the job, and then you have fewer. How about the recovery time? Is it quicker?
So I would compare it to the laparoscopic surgery. So if you compare laparoscopic surgery to open surgery with a bigger incision, it's definitely quicker.
Let's get a look at what Dr. Beninati's doing, okay? Sounds good. So, Dr. Beninati, what are you doing?
Just operating the console. So we're a short distance from the actual patient while we're operating, still with perfect view and communication with the team through the microphones built in. The stereoscopic viewer gives us a 3D picture, which is actually a much advanced image compared to the laparoscopic surgery. These remotes allow for the fine motor control of the actual instruments, and then there's also foot pedals that help control both the camera as well as cautery, a stapling device, a lot of the advanced equipment that we use in the OR.
So pretty much everything is done from this console, is that correct?
Right, so typically I'll set up the patient and then brake scrub, come over here, operate, and then return to the patient once the major portion of the robotic surgery is completed.
And then the staff is around the patient, though. The patient is attended to at all times by other staff, correct?
Yes, typically there's 3 or 4 providers around.
Great. Well, tell me this. Are all surgical patients candidates for the Da Vinci robot?
So each one has to be selected carefully. Not every patient would be a proper candidate. There are a lot of surgeries that would be maybe best performed either laparoscopic or open compared to robotic. Now, the trend is definitely moving towards robotics. Robotic surgery is not going anywhere. As the robotic community is learning more and having more education, better techniques, by far and away, I think a lot of the surgeries that we have been doing in different ways will be moving towards robotic surgery.
Well, you obviously enjoy robotic surgery, so what is your favorite part?
I would say just with my training in doing the laparoscopic surgery and advanced procedures that way, the robot really just adds to the visualization, to the control. For me, I'm able to control multiple arms, not just my only 2. So there's 3 arms that I can control with this, as well as the camera. And it just provides, I think, a better care in a lot of situations for the patient.
Yeah. It's like having lots of extra hands, right? And I'm sure there have been times where you wish you had another hand. So for patients having Da Vinci surgery, are there special preparations for the patient, or does it change their recovery needs, anything like that?
No, it's no different than laparoscopic in terms of the preparation, really. For the recovery time, there are some papers and research out there saying that some of the recovery time is actually quicker. So we're still looking into that as well. But it's a very similar recovery to a laparoscopic type of procedure.
Well, thank you both for sharing this new technology with us today. It's been really exciting. It's different for us. We're outside of the studio, so this has been really great. But before we close, is there anything that you would like to add, Dr. Scallion?
Well, if you or anybody has any questions, feel free to contact our office, and we'll be happy to do the best job we can to provide any information.
Mm-hmm. And we should just speak to the office, the practice manager, or?
Yeah, the practice manager is a good place to start.
Okay. All right, and we have that number, and we'll roll it across the screen. So thanks again. It's been a pleasure.
The Da Vinci system is an advanced surgical tool that allows doctors to operate minimally invasively for many procedures. The Da Vinci system has an ergonomic console where the surgeon sits while operating. A nearby side cart is where the patient is placed for surgery. There are 4 robotic arms. One holds the endoscope, a thin tube with a camera at the end. The second, third, and fourth arms hold the endo-wrist instruments, which are 100% controlled by the surgeon. The surgeon views magnified 3D HD images inside the patient's body. And the surgeon's hand movements are translated into smaller, precise movements of the endo-wrist instruments, which bend and rotate far greater than the human wrist. Combined, these features enable surgeons to operate with enhanced vision, precision, and control.
This is what security video used to look like, and this is HD video monitoring from ATMC Security. Now it's easier than ever to keep tabs on the kids, see when deliveries arrive, and make sure your home is secure. Check in from any device, anywhere. ATMC Security offers remote access, real-time alerts, video monitoring and recording, and more. Combine smart home solutions with 24/7 emergency monitoring for one great low price. ATMC Security. Safeguard your home.
Whatever it takes, wherever you are, whenever you're in need. Novant Health gives you easy access to remarkable care because she's more than a patient, she's your little girl. Novant Health, making healthcare remarkable.
Welcome to the show today, Mark. It's such a pleasure to have you.
Thanks, June. It's great to be back on it.
Well, good. Now, before we get started, I know we're going to focus on your practice today, but first, remind our viewers who you are and what you do, and a little bit about your education and your background.
Sure. I'm a general and vascular surgeon, and I've been here for about 15 years now, working in the Brunswick area and with Novant Health for most of that time. And originally, I did my surgery training in the University of Texas, and then I did my surgical training at UNC in Chapel Hill.
Good. Well, as I said, we're going to focus on your group today. And first of all, let's talk about the services that you offer. As one of the long-standing physicians in the group, share with us, our viewers, about your group's history.
Yeah, it's kind of an interesting history. It actually started before Novant Health was here. We were actually Brunswick Surgical Associates, myself and Dr. Herb Snyder, who unfortunately passed away last year. Nice guy.
Yeah, he was a nice guy.
Very nice guy. And about 8 years ago, Rich DeSandre joined us. And I think maybe it was 10 years ago. And then 8 years ago, Rich Scallion joined us. And 2 years ago, Max Beninati. So now there's 4 of us. We have well over 70 years experience among us all, and do all kinds of things that general surgery does.
Great. I think you have several locations now too, don't you?
We do. We have 4 sites now, or we will have 4, hopefully by the time this airs. We have our main site in Bolivia, which is on the campus with the hospital, and then at Carolina Shores, we have an office down there. We also have an office at Southport, pretty close to Dozier, and then we have a new office that will be opening up in Leland at the Waterford Medical Plaza.
What can you tell me about your partners at the Novant Health Surgical Associates?
Well, we have very strict qualifications for what we hire.
Well, that's good to know.
Yes. Everybody's board certified. Everybody's very good at what they do. But I think the other thing, people expect that kind of expertise. But we have a very compassionate group. The 4 of us, I think, are very personable, to be perfectly honest. We really see the importance of taking care of people. And we realize that when people come to see us, and they're facing surgery, they're going to need a lot of support.
Time. Yeah, that's a really bad time.
Yeah, they are all, I think, are very supportive, and I think the community's liked us. We've done our best.
I would agree with that. I hear really great things about your practice, and I've been in and out of your practice many, many times, and I've noticed that your team, your staff, they do a fabulous job. Let's talk a little bit about them. What would you say about your staff?
Well, I think we honestly have probably one of the friendliest and most efficient offices around. We have, beginning at the front end and including the nursing staff, we have people who are very bright and are more than willing to help in any capacity that they can. As a matter of fact, our office, the philosophy for the people in our office is if they can't figure out what you need from a surgical standpoint, we'll help find a place for you in terms of what you need from a medical standpoint. Because one of the things about general surgery, it's such an all-encompassing field that people don't quite get an idea what it covers. We'll cover everything from thyroid, breast, general surgery, all kinds of stuff. And so it can be complicated sometimes, where you have no problem. Even they'll take referrals from people who don't have referrals from physicians.
Really?
If it doesn't work based on their insurance, then we'll make sure we get it squared away beforehand, because we don't want to cause any undue burden to anyone, either medically or financially.
In terms of performing surgery, are your surgeries done here at Brunswick Hospital?
Yes, just about all our surgeries are done here. Some of the guys do have privileges at Dozier, and our hope is to be able to provide surgeries to everybody in Brunswick County, within Brunswick County.
When, say I'm going to have surgery and I come here to Novant Health Brunswick Medical Center, what might I expect? What might my experience be like?
Usually when you check in, there's usually very nice volunteers there, some of which have been our patients in the past, and they really understand what you're going through, and they'll help get you registered, get you squared away there. You go into a place that we call the ASU, which is the sort of pre-surgery area, and there the nurses will meet you and greet you, the anesthesiologist will meet you, you'll meet members of the operating room team, and from there you'll go back and have your surgery. The same people that perform your surgery will help follow you back out. If it's surgery that you're going to be going home that same day, or as we say, outpatient surgery, we'll make sure we get that all arranged. We're very good about keeping up with the family. There's actually a board that explains to you what progress, where the surgery is.
Yes.
So you can know if they're in surgery, out of surgery, recovery room. We take phone numbers, whatever we need in case people need to walk around, because some people are comfortable sitting in a waiting area, but others aren't so comfortable. So we make sure we catch up with the family members afterwards, because we know they're quite anxious. And if they're going to stay in the hospital, the nice thing is that all the rooms are private rooms.
Right.
All the rooms have
Their own
Wi-Fi,
bathroom.
television, their own bathrooms, a bed. Yeah, we try to make it as comfortable as possible.
Great, great. Well, how about sharing some information with our viewers about how to contact you and things like that?
Sure, yeah. You can contact us. We have a website, and the website is our name, which is a long name, Novant Health Surgical Associates. Our main office phone number is 910-721-4000, and you can always reach us that way.
Okay, great. Well, thanks for being with us today. We're glad to have you here at Novant Health, and really happy that you're in our community and offer services to the folks in Brunswick County. And now we're going to meet one of your colleagues, Dr. Richard DeSandre. So we're going to move on down the hall.
That sounds good. Thank you. And thanks for having me. It's always
No
nice to be
worries.
here.
Thank you. Welcome to the show today, Dr. DeSandre. It's so nice to have you here.
Thank you very much. My pleasure to be here with you.
Good. Well, let's start by learning a little bit about you and your background. So tell me where you went to school and where you did your residency.
I grew up in New Jersey. I went to college in Vermont and went to medical school down in Mexico and did my residency in New Jersey.
So you're a New Jersey native, are you?
I am.
And how do you love it here in Brunswick County?
Well, I've been in Brunswick County for almost 15 years, and I don't plan on going back, so I love it here.
I feel the same way. So I know that you're a long-standing member of your practice, and I was going to ask you how long you've been in Brunswick County, but you just told me 15 years. So today we want to learn a little bit about what you do at Novant Health Surgical Associates and what kind of procedures that you do.
Okay. We're general surgeons, so we do a great variety of procedures, period. We do upper and lower GI endoscopies. We treat reflux disease. We treat a variety of cancers, breast, thyroid, intestinal cancers. We do everything from neck surgery down to hemorrhoid surgeries and everything in between. And we offer what we feel is as high of quality care as anywhere in the country here.
Well, I understand that you do see many cancer patients. Let's talk a little bit about what you might offer for those patients.
We offer a comprehensive care. We have medical oncology and radiation oncology cancer specialists here in Brunswick County that we refer and utilize very closely. We have all the equipment to work them up and treat them, including radiation therapy. We give the chemotherapy in Brunswick County. We do the surgeries here at the hospital locally, and we can do rehabilitation after surgeries locally also.
I know that you probably receive most of your patients through referrals from internal medicine specialists and family practice specialists, but are there times when a patient can kind of self-refer to you?
Absolutely. We're more than happy to see anyone that can self-refer as long as it's okay with their insurance. And with most insurances, it is. And we're more than happy to see people as self-referrals.
How about breast problems in particular? If someone finds themselves, they wake up in the morning and they found a lump, can they just call the office and be seen for that?
Absolutely. We pride ourselves on being able to see a woman with a breast problem within 24 hours, hopefully the same day. We have 4 surgeons available, so on any given day there's someone that can certainly see the woman that's concerned about the problem and take care of it. We can often do an ultrasound right in the office, do a biopsy right in the office, all done that day. We usually get biopsy results back within 24 hours.
And that's so comforting for a woman because there's nothing worse than not knowing. It's better to know than to not know. Well, how about skin conditions? Do you treat many skin conditions like moles and things like that?
We do. Certainly, if someone has a mole that they're worried about or any kind of skin lesion that they're worried about, especially if they're worried about it being cancerous, we're more than happy to look at them and do biopsies or removal and take care of it. There are dermatologists in town, but they're kind of busy, and we do see it's a fairly large part of our practice that people come in for lesions to be seen, and we usually can often take care of them right the same day we see them.
Now, I understand that your office or your group offers some minimally invasive procedures also, and I wanted to talk a little bit about that.
We offer a wide variety of minimally invasive procedures. It's been found over time that less surgery and surgery that's at least less invasive and damaging to the body offers the same results as more expansive or more radical surgeries. And we offer minimally invasive surgery for breast cancer patients, and we have for many, many years. The other operations that we offer minimally invasive are for a variety of intestinal procedures, colon cancers, and things like that. And so we do pride ourselves in offering up-to-date procedures, and again, as we feel we offer as good of a option for treatment as anyone.
Yes. How about inter-office procedures and testing and laboratory work? Do you perform that in your office also?
We don't do blood work, but we can get blood work done either at the hospital or at one of our primary care's offices, but we do biopsies right in the office. We have an ultrasound machine, and we're more than happy to do thyroid biopsies, breast biopsies, and a variety of other biopsies right in the office. They are checked by a pathologist, and again, usually we have results 1 or 2 days they're back, and we can give them to the patient.
Well, that's all great information. We did meet with Drs. Scallion and Dr. Beninati, and so we learned about the Da Vinci robot, so that's another one of those less invasive procedures. And that was a lot of fun. We had a great time in there. Now, I hear a lot about colon cancer, and I know that we suggest that everybody get screened and what have you. Talk to me a little bit about that.
Yes, the standard recommendations are that men and women over the age of 50 all be screened for colon cancer in this country. The insurance companies cover it 100%, and we offer that in our office. The procedures are done in the endoscopy suite, and we're more than happy to perform these cancer screening procedures on people. And we feel that we can get these folks in fairly quickly for them, so we offer a good service.
Well, Dr. DeSandro, it was such a pleasure having you on the show today, and we've learned so many great things about your practice and all the things that the surgeons do. So thank you very much for your time. I know how busy you guys are, but we do appreciate it.
Thank you very much. My pleasure, June. I hope to see you soon.
Thank you for tuning in to ATMC TV's Health Watch. I hope you found this information to be beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. For more information on Novant Health Brunswick Medical Center, local doctors, or general health information, visit novanthealth.org. Thanks so much for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
Novant Health is in your corner every single round. Because you're more than a patient, you are a fighter. Novant Health, making healthcare remarkable.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.